Pinch me, I can't believe we're here. I've been in this industry for 14 years now, and I have many colleagues behind me, part of the Long-Term Care Forum. Raise your hand if you're part of the forum. These folks have worked tirelessly to get us to this point, and I just wanted to recognize my colleagues behind me. I would like to start off by sharing how I personally own my future. I like to think I'm a family man, and I own my future by spending time with my wife and kids. They're here today, at least most of them. Not here today is my stepson David, but I have with me my wife Cheryl, my lovely wife Cheryl, as you can see, daughter Alyssa and Grace, my son Wyatt, and my mother Linda. My family is why I have a long-term care plan and why I wish to own my future. In fact, I believe the essence of long-term care planning boils down to this: protecting my most valued asset, my family. I would like to reiterate what Joan said about staying healthy and active so that we can keep doing what we love to do for as long as possible. I enjoy helping my kids with 4-H, coaching Little League sports, gardening, tending to our hobby farm, and playing the organ for our church. My personal story is a big part of why I'm here today and so involved in this campaign, and why I advocate for families and individuals to have all the information they need to develop a long-term care plan for the future. My father, Robert, or Bob Eisenach to many, had a passion for serving others in this great state of Colorado. A farmer by trade from Fort Morgan, my dad was once the state president of FFA, taught Sunday school, served on the church board. He was later elected to the school board and then county commissioner. He served as a state representative in the building behind me. He ended his political career with an appointment by President Clinton to the chairmanship of the Farm Services Agency for the state of Colorado. I am sure my dad would have given just about anything to be here with us today. Unfortunately, he endured but ultimately lost his battle with Alzheimer's disease at a relatively young age. As I am sure many of you know, Alzheimer's disease can be very hard on a family, and it was on ours. Thankfully, my father had a long-term care insurance policy. You can probably guess who sold it to him. Ironically, the insurance protected my mother more than it protected my father. It allowed her to supervise his care, not be the 24/7 caregiver. His coverage also allowed him to stay at home for longer than he otherwise would have, until it became apparent that the care he needed to come from a nursing home. His long-term care insurance paid for that as well. Long-term care planning is a family process. It's important to discuss, plan, and make decisions about your long-term care needs together as a family. I know how difficult it can be to bring up this topic with your loved ones. Simply help them to realize this. 1, you might live a long life, and the longer you live, the more likely it becomes that you could need care for an extended period of time. Of course, younger people are not immune to needing long-term care. Nearly 40% of those who need long-term care are under the age of 65. 2, the physical, emotional, and financial consequences to your loved ones, to your financial portfolios, will also be devastating. Therefore, you need a plan. Your plan may include planning devices such as long-term care insurance, trusts, annuities, reverse mortgages, special uses of life insurance, and personal savings. But please realize that traditional health insurance and Medicare do not pay for long-term care. Instead, they pay for acute care, for short-term care, which may include hospitalizations, doctor visits, therapy to aid in recovery from illnesses or accidents. But long-term care is chronic care, lasting weeks, months, even years, and may not include the possibility of recovery. It may be due to an accident or an underlying medical condition, or because of living long enough to become frail and fragile. Long-term care limits our ability to do everyday tasks, such as eating, bathing, or dressing ourselves. It may also include supervision due to Alzheimer's disease or other forms of dementia. If a plan is not in place, the physical and emotional health of the family is at risk, as well as the income from the retirement plan and other assets. The time to plan is before care is needed, when a person has all of the options available to them. There is no better time than now to learn about them, so you can choose what will work best for you. Choosing the right option for you depends on several factors: age, life situation, personal situations and preferences, health status, risk of needing care, and your personal financial situation. If you choose long-term care insurance, it basically works like this. You design a policy based on your budget and needs. Premiums are based on your age, health, marital status, and benefit selection. The coverage is triggered in the future by needing care, either supervision due to a cognitive impairment such as dementia, or requiring assistance in daily activities such as bathing, dressing, eating, or others. You may have a deductible or elimination period before the benefits begin, and then the policy pays, up to its coverage limit or for an unlimited period of time, for the long-term care you need, when you need it, and where you need it. Modern policies cover home care, assisted living facilities, nursing homes, hospice care, and more. Some policies may even provide money you may use to pay a family member for care services. And premiums are typically waived once you receive care. Once you are accepted for long-term care insurance, your coverage cannot be canceled for any reason other than non-payment of premiums or if you have exhausted the policy benefits. Some good news. Policies purchased since January 1st, 2008 may qualify for Colorado's new long-term care insurance partnership program. It is an alliance between the private insurance industry and the state government to help Colorado residents plan for future long-term care needs without depleting all of their assets to pay for care. The partnership program enables Colorado residents who purchase qualifying policies to keep assets protected if they later need to access the state Medicaid program. This gives Coloradoans greater control over how they finance their long-term care. I understand the details can be daunting and overwhelming, but we are here to help you and your family through the process one step at a time. With the right planning, we can reduce stress for our loved ones and ensure the necessary resources will be available when we need them most.